resistance to BTK inhibition is a pretty interesting field. You can think of it two ways. There is an inherent resistance that we see. In other words, patients who start on BTK inhibitor therapy often get a good response to therapy, but they don't get a complete response. So that means there are cell populations remaining in that patient who are relatively resistant to the BTK inhibitor from the day the patient starts the therapy. And we're still learning what these inherent resistance mechanisms are, and I think generally this is not well understood. And then there's the problem of acquired resistance or developing resistance while you're on BTK therapy. And like with other kinase inhibitors, sometimes there are little mutations that develop in the BTK enzyme so that the BTK doesn't fit into its normal pocket where it binds and inhibits. There's a fairly well-characterized mutation in CLL. I believe it's the BTK 481 cis mutation. And this results in a conformational change in BTK, and the BTK inhibitors can't bind and inhibit as well. So this is sort of a mutation that develops in the CLL cells in patients who are on BTK inhibitor therapy. That is a very common acquired mutation in CLL patients. It turns out that mutation is less common in mantle cell patients who acquire resistance. And in Waldenstrom's, I think it explains about half the cases of resistance. So there are other mutations that can be acquired in addition to this 481 cis mutation. And I think the field is just really starting to unravel all these acquired mutations. And going forward, I think you'll see a lot of drug development strategies looking to develop drugs that are not affected by these mutations, or perhaps develop combination therapies where you give a BTK inhibitor plus another kinase inhibitor that can overcome acquired resistance. So resistance is a moderate problem in BTK inhibitor therapy. The drugs work very well, and most patients who get a response are still enjoying that response, after 2 years. But there's definitely a fraction of patients, and it varies from disease to disease. If you're a CLL patient, there's a good chance you're still on your BTK inhibitor 3 years after starting treatment and you haven't developed resistance. But if you're a mantle cell patient, the odds are you're not on your BTK inhibitor after 3 years and you've already developed resistance to that and had to move on to other lines of therapy. So I think there's a lot of biology there that we don't understand yet, and I think this will be a big effort in the field over the next few years, trying to sort out what are the resistance mechanisms and how they're different from disease to disease.